the global health community is confronting renewed scrutiny over its readiness for viral threats following a deadly outbreak of hantavirus linked to an international cruise ship. The incident has spotlighted the stark reality that no broadly available, highly effective vaccine exists to shield populations from specific dangerous strains of this pathogen. While public health agencies emphasize that a wide-scale global pandemic remains highly unlikely, the event has triggered significant tracking and concern among international health organizations, including the World Health Organization and the Centers for Disease Control and Prevention. The core of the current situation traces back to an outbreak aboard the MV Hondius, a Dutch-flagged wildlife expedition cruise ship that departed from Ushuaia, Argentina, on April 1, 2026. As the vessel traveled across the South Atlantic Ocean, stopping at remote sites including Antarctica, South Georgia Island, Tristan da Cunha, St. Helena, and Ascension Island, a cluster of severe acute respiratory illness emerged among its passengers and crew, who hailed from 23 different countries. On May 2, 2026, the World Health Organization was formally notified of this cluster, which at the time included 2 deaths and 1 critically ill passenger. By May 6, laboratory testing confirmed that the pathogen responsible for the infections was the Andes virus, a specific type of hantavirus primarily found in South America. The Andes variant is uniquely concerning to virologists because, unlike most other hantavirus strains which rely exclusively on direct animal-to-human spillover, the Andes virus is the only known hantavirus variant capable of person-to-person transmission. This transmission typically requires close, prolonged contact or direct exposure to an infected individual's saliva, respiratory secretions, or bodily fluids. To understand the wider context, hantaviruses are a family of enveloped, negative-sense RNA viruses belonging to the order Bunyavirales. In the Americas, they are notorious for causing hantavirus pulmonary syndrome, a severe and rapidly progressing respiratory illness with a historically high case fatality rate that can reach up to 50%. In Europe and Asia, different strains of the virus cause hemorrhagic fever with Raynaud syndrome, which exhibits a mortality rate of up to 15% in severe cases. The virus is natively maintained in rodent reservoirs, and human infections traditionally occur when individuals inhale microscopic airborne particles or aerosols contaminated with the saliva, urine, or droppings of infected rodents. The cruise ship incident represents a rare and complex containment scenario, drawing attention to long-standing gaps in specialized antiviral and vaccine pipelines for neglected tropical and regional pathogens. Investigations and official statements from regulatory bodies have underscored severe limitations in existing medical countermeasures. On May 12, 2026, the European Medicines Agency issued a definitive statement clarifying that no approved treatments or vaccines currently exist within the European Union to directly combat hantavirus infections. The agency explicitly dismissed circulating online claims that attempted to link the virus to COVID-19 or COVID-19 vaccines, labeling such rumors as dangerous misinformation. The European regulator emphasized that clinical management for infected patients relies entirely on supportive medical care and timely access to critical care or intensive care facilities. According to health advisories issued by the United States Centers for Disease Control and Prevention, patients with suspected hantavirus pulmonary syndrome can deteriorate with extreme rapidity, making immediate clinical referral vital. For severe cases, the early deployment of extracorporeal membrane oxygenation, a form of advanced life support that oxygenates blood outside the body, can significantly improve survival rates to approximately 80%, provided it is initiated before irreversible lung damage occurs. Currently, the only licensed vaccine globally is an inactivated whole virus vaccine known as Hantavirus, developed and utilized in South Korea since the 1990s. However, scientific assessments show that Hantavirus possesses low immunogenicity, requires multiple doses, and is structurally targeted against the Hantavirus strain. Consequently, it is completely ineffective against the South American Andes variant that attacks the lungs and causes person-to-person transmission, and it lacks authorization from European and Western drug regulators. The sudden urgency has exposed the history of halted pharmaceutical research. A Bloomberg report highlighted that Chilean virologist Maria Inés Barria, working at the Universidad San Sebastián, had successfully developed monoclonal antibodies that neutralized the Andes hantavirus in animal models back in 2016. However, her lab was forced to shelve the project just as it reached the human clinical trial stage because funding dried up and global resources were later diverted toward the COVID-19 pandemic. Barria estimated that it would now take 1 to 2 years of renewed investment and specialized infrastructure just to return her team to their pre-pandemic research position. Similarly, Professor Kartik Chandran at the Albert Einstein College of Medicine has been developing a candidate vaccine and antibody treatment targeting the GN and GC surface glycoproteins of the virus, which form the spike-like projections necessary for cellular entry. While early trials showed protective efficacy against the Andes strain, Chandran noted that moving to human clinical trials is incredibly difficult due to the low, sporadic number of natural cases, making large-scale efficacy testing non-viable for commercial pharmaceutical giants. Major companies like Moderna have active hantavirus projects using modern mRNA platforms, but financial analysts from firms like the Motley Fool warn investors that the small, highly localized market for hantavirus vaccines makes them financially risky and non-lucrative for big pharma, leaving development heavily dependent on public subsidies. Given the absence of an effective, universally authorized vaccine or specific antiviral drug, public health guidance remains anchored in strict environmental management, surveillance, and localized containment. The European Commission has active preparedness frameworks, having included hantaviruses in its 2025 Comprehensive Health Threat Prioritization Assessment to fund early-stage medical countermeasures, yet immediate prevention relies on traditional sanitation. Standard protocols advised by health agencies focus heavily on controlling rodent populations and mitigating exposure to their habitats. In residential, rural, or agricultural settings, this requires sealing gaps and structural openings in homes, cabins, and barns to prevent rodent entry, alongside storing all food supplies in rodent-proof containers. When cleaning areas with suspected rodent infestation, public health officials warn against sweeping or vacuuming dry materials, as this action stirs up dust and creates the exact infectious aerosols that transmit the virus. Instead, standard guidance dictates thoroughly venting enclosed spaces before entry and wetting down contaminated areas with heavy disinfectants or a bleach solution while wearing protective gloves and masks. Globally, hantavirus infections remain relatively rare but highly lethal geographic anomalies. World Health Organization statistics show that in 2025, the entire region of the Americas reported 229 cases and 59 deaths. In the European region, 1,885 cases were logged in 2023, representing a low baseline rate of 0.4 infections per 100,000 people. Regarding the MV Hondius cruise ship outbreak, the World Health Organization confirmed that as of May 8, 2026, the cluster consisted of 8 total cases, 6 confirmed and 2 suspected, resulting in 3 fatalities. One passenger died at sea on April 11, whose body was removed at St. Helena on April 24th, where his spouse disembarked before subsequently dying in a hospital in Johannesburg, South Africa. Genetic sequencing performed by international laboratories strongly suggests that all cruise ship cases originated from a single, very recent zoonotic spillover event rather than an altered or highly contagious mutant strain. Authorities state there is no current indication of increased transmissibility or heightened clinical severity compared to historical Andes virus baselines. Epidemiologists continue to emphasize that because the general public does not maintain close contact with specific rural South American rodent vectors or affected individuals, the broader global health risk is profoundly low, demanding calm vigilance over panic. For continuous updates on international public health developments and specialized scientific reporting, consider subscribing to this channel. Official statements and regulatory updates have highlighted severe limitations in current medical countermeasures and the historic underfunding of specialized antiviral research. On May 12, 2026, the European Medicines Agency issued a definitive brief clarifying that no approved treatments, specific antiviral drugs, or preventive vaccines currently exist within the European Union to directly combat hantavirus infections. The agency explicitly rejected circulating online claims that attempted to link the virus or the current outbreak to COVID-19 or COVID-19 vaccines, categorizing such rumors as dangerous public misinformation. The European regulator emphasized that clinical management for infected patients relies entirely on supportive medical care and immediate access to intensive care or critical care facilities. This assessment aligns with data published in the New England Journal of Medicine and NEJM Evidence on May 20, 2026, which analyzed 10 of the 11 total cases linked to the MV Hondius cruise ship. According to the data, 3 of the 10 documented patients died, and 2 remained hospitalized, including 1 passenger in an intensive care unit in Johannesburg, South Africa, and another in a hospital in Switzerland. Medical specialists from South Africa, the United Kingdom, and the Netherlands held a virtual consultation on May 2 to analyze the initial deaths and coordinate diagnostic testing. Samples sent to South African laboratories and the Geneva University Hospitals in Switzerland utilized polymerase chain reaction testing and pre-death genetic sequencing to officially confirm the presence of the Andes hantavirus strain, designated as ENV. The unique danger of this strain was underscored by health agencies, which noted that while typical hantaviruses only spread through animal-to-human contact, the Andes variant can transmit between humans via prolonged close contact, which scientists believe occurred inside the vessel after an initial land-based exposure. Currently, the only licensed vaccine globally is an inactivated whole virus formula known as Hantavirus, which has been utilized in South Korea since the 1990s. However, scientific analyses show that Hantavirus possesses low immunogenicity, requires multiple doses to achieve any baseline protection, and is engineered specifically against the Hantavirus strain. Consequently, it is entirely ineffective against the South American Andes variant that causes severe respiratory illness, and it lacks regulatory authorization from the European Medicines Agency or Western drug regulators. The sudden crisis has exposed the vulnerability of halted vaccine pipelines. A Bloomberg report detailed that in 2016, virologist Maria Inés Barria at the Universidad San Sebastián in Chile successfully developed monoclonal antibodies that completely neutralized the Andes hantavirus in animal models. However, her laboratory was forced to shelve the project just as it reached human clinical trial stages because financial resources dried up and global attention later shifted entirely toward the COVID-19 pandemic. Barria stated that the virus had gone largely overlooked outside southern Chile because it is naturally rare and geographically concentrated, noting that her team would now require 1 to 2 years of continuous funding and specialized infrastructure just to return to their pre-pandemic research position. Concurrently, Professor Kartik Chandran at the Albert Einstein College of Medicine has been working on a candidate vaccine and antibody treatment designed to target the surface glycoproteins of the virus to block cellular entry. While early laboratory trials demonstrated protective efficacy against the Andes strain, Chandran told Bloomberg that moving forward with human clinical trials remains extremely difficult. Because natural hantavirus cases occur so sporadically, conducting large-scale human efficacy testing is non-viable for commercial pharmaceutical entities. While the European Medicines Agency has tasked its emergency task force with mapping research centers and involving major pharmaceutical companies like Moderna to prioritize hantavirus projects using modern mRNA platforms, and South Korean scientists are attempting a rapid 200-day pandemic vaccine framework, international public health experts stress that the small, highly localized market for hantavirus interventions makes them financially risky for major developers, leaving immediate care dependent on existing critical hospital support. Given the complete absence of an approved, globally effective vaccine or specific antiviral treatment, public health guidance relies heavily on strict environmental management, localized containment, and rigorous surveillance protocols. The ultimate defense against hantavirus infection remains anchored in preventing human exposure to its rodent reservoirs. Public health agencies, like the United States Centers for Disease Control and Prevention and the World Health Organization, outline standard, practical takeaways for individuals residing in or traveling through endemic rural areas. Because the virus is shed in the urine, saliva, and droppings of infected wild rodents, structural exclusion is the first line of defense. This involves sealing holes or cracks larger than 1/4 of an inch in homes, cabins, and outbuildings, utilizing metal flashing or steel wool. All food supplies, pet kibble, and trash must be stored in heavy, rodent-proof containers to eliminate attractants. When entering or clearing out structures that have been closed for extended periods, such as barns or vacation cabins, public health officials issue a critical warning: never sweep or vacuum dry droppings or dust. Doing so stirs microscopic viral particles into the air, creating the exact infectious aerosols that cause hantavirus pulmonary syndrome when inhaled. Instead, the universally accepted protocol dictates opening doors and windows to vent the space for at least 30 minutes, followed by thoroughly spraying the affected areas with a heavy commercial disinfectant or a 10% bleach solution. Once the materials are completely wet, they must be wiped down carefully using paper towels while wearing protective rubber gloves and a face mask, and then disposed of in sealed bags. In the unique context of the Andes virus variant, public health guidance expands to include strict isolation protocols for known cases due to its verified capability for person-to-person transmission through close contact. Globally, hantaviruses remain classified as relatively rare but highly lethal geographic anomalies, which demands that public health communication balance honest warnings with strict ethical calm to prevent societal panic. According to official World Health Organization tracking data, the entire region of the Americas recorded 229 cases and 59 deaths across the full year of 2025. In the European region, surveillance networks logged 1,885 cases in 2023, which represents a highly stable low baseline infection rate of just 0.4 cases per 100,000 people. Regarding the specific maritime outbreak, the World Health Organization confirmed that as of mid-May 2026, the entire cluster consisted of 11 total cases, resulting in 3 confirmed fatalities. Crucially, intensive genetic sequencing conducted by international laboratories indicates that all 11 infections on the vessel share an identical genetic sequence, tracing back to a single localized environmental exposure event that occurred on land in early April during a passenger excursion. This laboratory data provides immense reassurance, as it proves that the virus has not mutated into a more contagious or altered strain with heightened transmissibility. Epidemiologists emphasize that the broader threat to the general public remains profoundly low, as the virus cannot sustain wide-scale transmission outside of dense, prolonged contact zones or direct exposure to localized rodent populations. The ethical obligation of global health reporting is to highlight that while Big Pharma may find a localized pathogen financially non-viable to solve, public infrastructure and rapid clinical response are what stand between isolated outbreaks and broader public safety. For continuous, strictly factual updates on global health surveillance and specialized medical reporting, consider subscribing to this channel.